Welcome, friends. Mike Collins here, owner and pharmacist at Healthway Compounding Pharmacy. Today's prescriber spotlight, we have Dr. Dawn Johnson again. Hello, Dr. Johnson. How are you doing today?
I'm good,
We're doing
thank you.
good. So now we're going to talk a little bit about a topic that I often get asked every single day. Women come into my pharmacy and they'll say, Mike, what have you got that I can lose some weight? And unfortunately, to me, all these things roll through my brain knowing that this is a loaded question, that there isn't just one supplement that I can give to a lady and she can drop 10 pounds tomorrow. It's just not going to happen that easy. So I typically would refer them to a prescriber like you that would say, hey, this is the approach that I would take. So if a person comes in to meet with you and wants to talk about weight loss, what are some of the first things that you guys would speak about?
Great question. I too get this every day, and it's super important, not only for what we look like, but for our health to lose those unwanted pounds. I also don't have a one-size-fits-all answer. There are some supplements that we could talk about later, but I like to keep it simple. Not that it's easy, but simple is a mnemonic that stands for sleep is the S, intermittent fasting is the I, M is for movement, P is play more, less stress, L is the less stress and also a hormone called leptin. We'll talk a little bit about that in a minute. And then E is energy, connection, and how we relate to the world.
Cool. That's a very good, interesting point. So what are some of the supplements that you might talk to someone about? I would think, what would you do in your first session? So talk about what your first meeting with a patient would be like, because I think that this is such a complicated topic that they really need to meet with someone like you, a holistic practitioner, that's going to work with them on a lot of different levels.
I agree. Somebody who's going to have the time to really get to the root cause of your issues with your weight. So for some people, that could be concerns from trauma of the past, and that's not going to get better with a pill from a bottle. It could be that we have allergies to some foods that we really like to eat.
Sure.
And when I say allergies, I really mean more like intolerances, things that create inflammation in our body. And then it's up to our body to try to protect us from that. And sometimes it does that by putting on extra weight. Other times, I feel that some people come to me and say, I am hungry all the time. If that's the case, there is a supplement that I like to use called Leptin Manager, and it just helps us feel full. It helps us do the things that getting better sleep can also do.
Sure.
And having positive relationships can also do. So it's not a quick fix, it's in conjunction with these other tips.
Yeah, awesome. That's really, really good. So Dr. Johnson did mention one particular supplement, but again, we know that this is not a one-size-fits all problem, and we know that leptin is only a piece of the puzzle. So in our next lecture or next talk that we're going to talk about, we're going to kind of dive a little bit deeper into some of the other areas that Dr. Johnson would work with you on in maybe second, third, or visits like that. So Dr. Johnson, thanks for being with us today.
Thank you, Mike.
And we'll talk to you again, friends. Thank you.